Welcome, everybody. Welcome, welcome. I see a few people joining us. Feel free to turn on your cameras if you want to, so we can see your lovely faces. Otherwise, you can go ahead and write on the chat where you are joining us from today. We'll just give it a few minutes to let people log in. Welcome, everybody. Okay, we'll give it maybe one more minute to let people join us. I see a few names that I recognize in the audience, so hello, hello. Okay, well, I'll get started with some quick introductions. I let people roll into our webinar today, but you are joining us for the Spring 2023 Global Gopher Experiences Health and Wellness webinar. If you are a new student coming this spring, welcome to the University of Minnesota. I'm super excited that you'll be joining us. And if you're a current student, welcome again. We absolutely love having you all here with us today. As folks are able to join us, if you could write where you're joining us from on the chat, that would be great. Gives us an idea of whether you're a new student, current student, if you're here in Minnesota, or if you're still in your home country. So it is an honor to welcome you all to this information session on well-being and health in preparation for the start of the spring 2023 semester. According to our student surveys that we've done, we know that the #1 concern of our international students is their health and well-being. So you are the right place today. It is not only about maintaining your physical health, but also your mental health as well. Both are equally important to be successful at the University of Minnesota. As many of you may know, U.S. healthcare can be complicated and often confusing. So we have lots of campus partners today that can help us navigate a lot of complicated information. It is critical for you to navigate and use our university health resources. And we are fortunate that today's session provides you clear information and specific next steps for you. We also want to assure you that hundreds of students do this successfully and navigate healthcare and well-being each year. I remember when I was an international student from Argentina and having to navigate health and well-being and how easy it was to use the Boynton's pharmacy on campus, for example, over at the East Bank, or to see a therapist to check in about my well-being, or having folks that really care about international students in the Office of Student Health Benefits and Housing and Rest Life. For today's session, on the next slide, you will see that the session is now being recorded. It will be posted on the ISSS website, and we will be sending this to you afterwards. We recommend using the gallery view or the speaker view. General information will be provided today, and we expect that you may need to reach out to an office about a situation specific that you may have. The first 20 to 30 minutes, our panelists will be introducing themselves and reviewing general information related to health and wellness. Today, we have partners from Boynton Health Services, the Office of Student Health Benefits, and the Office of Housing and Residential Life. The second part of this session today will be questions and answers that were submitted prior to registration, and we'll allow some of you to also ask questions live by submitting them on the chat. So at the bottom of the screen, you will see a chat button. You can click on that and submit your questions. If you do not want to share your name with the rest of the audience here today, you can send those questions to me directly on the chat. Again, welcome everybody to the University of Minnesota Global Gopher Experiences. My name is Marina Wejara, and I use she, her pronouns, and I'm the Program Director for Student Engagement here in ISSS. And I'd like to now introduce Michelle Trumpy, Director of Public Health at Boynton Health Services at the University of Minnesota.
Thank you, Marina, and welcome everyone. Welcome to new students to Minnesota, and welcome to returning students as well. I'm really excited to share with you about Boynton today. There's a lot of information that I have for you today, and there's a lot of links So feel free to go back. As Marina said, you may need to follow up with someone, and that is absolutely okay as well. So I'm Michelle Trumpy. I'm the Director of Public Health at Boynton. I've been here in this role since August, but I am a Gopher. I did my Master's of Public Health here in 2005, 2006, and used Boynton when I was a student, and I'm really proud to work here and share with you all the great resources. So here at Boynton, we've been taking care of students for over 100 years, and we're very used to working with students who may be new to navigating the healthcare system. And so if you're not feeling well, we hope that Boynton is one of the first calls that you will make. We have a lot of clinics and a lot of services all under one roof at Boynton. We are a comprehensive college health service. So this is just a quick snapshot of the different services that you would be able to receive at Boynton. I want to also make clear that the people who work at Boynton are all accredited medical professionals in their fields with years of experience. So they're not students or graduate students or trainees. They are full-on professionals. And I also wanted to make note specifically of our eye clinic. You are allowed one comprehensive eye exam every single year as part of your student health benefit package. And so you can make that appointment after your insurance benefits kick in. And it's important to note that you can make that appointment even if you don't regularly wear glasses or haven't had an eye exam before. It's a really important part of your overall health and well-being. Next slide. Here's where we are located. So there's a little map. You can see that we're right behind Kaufman Union on the East Bank, and that's where all those services are located. The hours are here. So Monday, Tuesday, Wednesday, and Friday from 7:45 until 4:30. And we open just a little bit later on Thursdays. And we also have the St. Paul Satellite Clinic as well. So in that building, we offer primary care, mental health, physical therapy, nutrition, and Gopher Quick Clinic. And then there's many ways that you can get a hold of Boynton on the next slide. So you can call to make an appointment, and the phone number is here. You can go online to schedule at the My Boynton portal. You can go to urgent care, and this is, you do not need to make an appointment, but if you're having something that requires something more urgent, for example, a very bad headache, flu, frostbite, maybe you were injured at work, and you need to see a medical professional right away, you can walk into our urgent care at East Bank. The nurse line is available 24/7. So maybe you're not sure if you need to go in or what kind of care that you might need. You can give the nurse line a call, and they're available 24 hours a day, 7 days a week, and they can help direct you. I actually had to call the nurse line last week because my husband slipped on the ice, and it was really helpful to know what signs and symptoms to look for and if he needed to go in or not. So that's a service that I definitely recommend for students. All right, next slide. So I'm going to talk with you about the immunization requirements and the reporting. There is a lot of information to share here, and this QR code will bring you right to the website where all this information is housed, but we're going to talk through it step by step. So all students are required to get the COVID-19 vaccine, and as an international student, you would be required to receive that and be fully vaccinated with either the 1 dose if you're getting a 1 dose vaccine or the 2 dose vaccine before arrival. And you need to submit that to the to your MyU portal, and we'll talk about that in a minute. But you also need, all students need to have the diphtheria and tetanus vaccine. That is 1 vaccination within the last 10 years. And then the measles, mumps, and rubella, that is those 3 shots are in 1 vaccination, and it's a 2-dose series. And that there's a form on the Boynton website you can fill out to verify your proof of that. There's other vaccinations that are recommended but not required. So those are on the right-hand side of the screen: meningitis, the human papilloma virus or HPV, hepatitis B, and then the annual flu vaccination. And Boynton can help if you want to get any of these vaccinations, the required or the recommended. We're here to help you get that. So then a little bit about the reporting. This is for the COVID-19 vaccine. You would go into your MyU account and you would click on My Info, which is on the left-hand side of the screen, and it's the very last one. It's the one on the bottom. And then you can see the second arrow. It says report a vaccination or exemption, and you just follow the prompts, and you have to upload your proof of vaccination as well, and then you would be considered complete. It's very important to know that a hold will be placed on your record, so you wouldn't be able to register for classes in the fall until this is completed. So it's really important to get that taken care of. And you should have received an email with more information on this. And once it's done, you don't have to do it again. It's just one time. And so then for the vaccinations, for the COVID-19 vaccinations that are considered approved, here's 3 different lists, but I think the most comprehensive one is the one in the middle. So that's what's approved by the World Health Organization. And it includes the 4 that you would be able to get in the US, which is on the left-hand side. And then the one on the very right-hand side, that has not been approved, that Medicago. There was some promising information about it, but it hasn't been approved. So when you go in to put your vaccination into your MyU, these are the choices for vaccination that you would see, and you would just click which one you got, and then you would move through the series. And then this is just a little bit more information about what would be considered appropriate documentation. And again, you're considered fully vaccinated 2 weeks or 14 days after your first dose of an acceptable single dose vaccine, or 2 weeks or 14 days after your second dose of an approved second dose vaccine. So I know that there can be a lot of questions about that. So feel free to put them in the chat, or if you still have questions, we can help you out at Boynton as well. So the next piece of information here gives you just a snapshot of what's happening with COVID on campus and COVID from the Minnesota Department of Health as well. So we track the positivity rate of COVID-19 testing that's done either in our clinic or what we call M-Test, which is a really easy way for people to get COVID testing. So this last week, it was at almost 21%. And for the last 5 weeks, it's been somewhere between 12 and 14%. But this is, again, only the cases that have come through the testing. It's not any positives that might have been detected on a home test. All of the test results are published on the campus dashboard. So there's a link right here if you ever wanted to check in and see how we're doing. And over 96% of our campus population has been vaccinated against COVID-19. We are very fortunate in the state of Minnesota to have a very strong public health department with lots of access to data on what's happening with COVID-19 in our community. So we do know that 72% of people who are age 5 and older have completed the vaccine series throughout the state of Minnesota. That's amazing. That's really great. As of December 22nd, the 7-day case average was 266, but again, that doesn't include any at-home tests. And in general, right now, COVID is less severe, but the virus is still circulating throughout the state. So there's a lot of ways that you can keep yourself safe from COVID and other respiratory illnesses that are circulating. Next slide, please. You might also hear about influenza, that there's a lot of cases of influenza and RSV, respiratory syncytial virus. And the great thing is that keeping yourself safe from all of these are basically the same thing. So first of all, stay home if you're feeling sick. That's a really important way to protect others from getting sick. And there's information on the SafeU website about that, about staying home if you're sick and letting your professors or teachers know about that, and people are very understanding. Test for COVID-19 if you're feeling sick, and follow the isolation guidelines if you test positive. There's several ways that you can get tests here at Boynton. You can get free at-home antigen kits. Just from coming into Boynton, you can get one test. If you want to get more than one test, maybe you want to have a couple on hand, you can go to the Boynton Health Pharmacy and let them know that you would like more tests, up to 8, and they will bill your insurance for that. And those are antigen tests as well. Or if you want to get PCR testing, that is covered under MTest, and we have that available 5 days a week at the East Bank campus location, and 2 half days, Tuesdays and Thursdays, in St. Paul. It's really important to stay up to date on your COVID-19 and influenza vaccinations. So to meet the university requirement, you only need to have completed your primary series. So that's either the 1 dose or the 2 dose, depending on which vaccine you got. But it's also very important from a public health perspective to stay up to date on your boosters. And so the most recent approved booster that came out is the bivalent booster that includes protection against 2 strains of the Omicron subvariants, B4 and B5. And the booster is available, and the influenza vaccination. Again, that's not a required vaccination, it's a recommended one, but both are available in the Boynton lobby from 9 a.m. to 3 p.m. and Monday through Friday. And we're going to be offering that through February. So it's a great way. You don't have to make an appointment. You can come on in, you can check Boynton out, you can get up to date on your vaccinations, you can pick up an antigen kit, and you can pick up a high quality mask also at Boynton at the same time. It would be a wonderful trip there. It is not required to wear masks, but wearing a high quality, well-fitted masks indoors and around others is a perfectly fine thing to do. And it's a recommendation to help from getting sick. So Boynton Health offers free KN95 masks for students. And then washing your hands with soap and water on a regular basis is a very important thing to do to keep yourself feeling well. I just talked a lot about COVID-19 vaccination and testing, and all of that information is located on the Boynton website, and there's the link for you. So just a little bit about some other health promotion and public health programs that we offer. This Share the Air is actually a policy that's important for everyone to know, that the University of Minnesota Twin Cities campus is smoke and tobacco free. And that means smoking is not allowed indoors or outdoors on our campus. And that does include electronic cigarettes as well. If you are using tobacco products and you want help quitting, Boynton offers that. So here's a link to the different cessation resources that we have. The Nutritious You Food Pantry is an awesome program that we have that offers fresh and healthy food to students who need it. No proof of need is required. It's something that we offer at Kaufman Union behind the Goldie statue. It's offered, so if you go right in the door there, you'll see it right on the left-hand side. It's open 3 days a week, 1 time per month. So the next time we're going to have it is at the tail end of January 24th through 26th, and it's open from 12 to 6. The Gopher Chauffeur is another awesome program that offers free rides to students in the evenings to their home around campus. So if you're out studying late night at the library, or maybe you're out with friends and you want to ride home, you can download the Gopher Chauffeur app on your phone, and you can put in where you are, and the Gopher Chauffeur will pick you up. That service runs from Sunday through Wednesday from 8:30 to 12:30. And then on the weekends, it runs later. Thursday through Saturday, it's 10 p.m. to 2:30 a.m. They don't run during breaks. So the next time the Gopher Chauffeur starts running is January 17th. This next program is one of my favorites, Pause, Pet Away Worry and Stress. They have registered therapy animals come to different places on campus. It's free, it's lovely, it's really makes you feel good and helps reduce stress. It's at our rec wells on Monday, St. Paul campus on Tuesday, the Union, Kaufman Union on Wednesday, and the West Bank on Thursday. And this link will get you to the calendar and you can see where it's coming up next. I'm going to just talk to you really briefly about health advocates. These are student resources in the residence halls and the apartments, some off-campus or on-campus apartments, fraternities and sororities, and they're students who can help be a resource for various things like cough drops or sharing info or other health resourcing. You can go to the next slide. They're first aid and CPR certified. They can respond to common health issues. So if you're living in a place like in the residence halls or another place with a health advocate, they're a great person to meet and get connected to. Then I think I have one more slide, which just talks about some other programs. Boynton offers free safer sex supplies, condoms, lube, that you can get that through the pharmacy. We have Recovery on Campus, which is a student group that provides resources and support for university students living in recovery, and nutrition checkups, which is dietetic students offering free nutrition checkups to students who are interested. And finally, my last slide is a QR code with Boynton's main website, where you can look up any of the information I just talked about or to learn about all the great resources that Boynton has to offer.
All right, I will introduce myself. My name is Greg Thurston. I'm the director of the Office of Student Health Benefits. I think we can go to the next slide real quick here. So today I want to highlight health insurance requirements for the University of Minnesota, as well as some items related to health insurance. You can go back one slide, please. As well as some items related to health insurance in the United States that may be different from health insurance in your home country. Health insurance in the United States is complicated, even for those of us who were born here. And so in the few minutes that we have now, I can't make you an expert on it. In fact, the booklet that talks about the health insurance policy that you'll be on, it's known as a summary plan description, and it's over 100 pages long. It's posted on our website if you ever want to have some late night reading or anything like that. After this presentation, you're likely going to have some additional questions in the future. And so I want to assure you that the Office of Student Health Benefits contact information, which is provided here, we're here to, and we're committed to help you with any question that you're going to have now or in the future. So as you come up with these questions, please feel free to reach out to the Office of Student Health Benefits. Next slide, please. So first, it's important for you to realize that unless you qualify for a waiver, the University of Minnesota requires you to be on either the university's student health benefit plan or the university's graduate assistant health plan. This requirement has been in effect for over 40 years, and it applies to all students, both domestic and international. It's necessary so that you can focus on academics and not worry about whether you can obtain medical services if any health issues arise. Waivers from coverage on the university plan are only granted if you're remaining in your home country for the semester or have United States employer-based health insurance, or your home country has an arrangement with the university which qualifies you for a waiver. And only the countries of Oman, Saudi Arabia, United Arab Emirates, and Kuwait have arrangements that allow waivers. If you qualify for a waiver, you should email the Office of Student Health Benefits for assistance with that process. Next slide, please. If you're a graduate fellow or a graduate assistant with a qualifying appointment from the university, you should enroll in the Graduate Assistant Health Plan. The university pays a significant portion of the premium for the graduate assistants, so your contribution is really low. At the beginning of the semester, your account is charged $171.96. Then if your appointment is 50%, you pay no additional premium. If your appointment is less than 50%, you pay an additional amount for the semester based on your appointment level. You must complete an enrollment form to enroll in the Graduate Assistant Health Plan. To enroll, you'll go to our website, which is that shb.umn.edu, and select Graduate Assistance, then select Enrollment. Complete and submit the form to the Office of Student Health Benefits. I do want to point out that failure to actively enroll in the Graduate Assistant Health Plan would result in the graduate assistant being automatically enrolled in the Student Health Benefit Plan and then charged its full cost of coverage. So I really want to stress that if you're a graduate assistant, you want to make sure that you actively enroll in the Graduate Assistant Health Plan because it is the best option for you. However, if you're a graduate student without an appointment, or all international undergraduate students who do not qualify for a waiver, being from Oman, Kuwait, one of those countries, then you must enroll in the Student Health Benefit Plan. The cost of the Student Health Benefit Plan is $1,734 per semester, and it's billed to your account at the beginning of the semester. To enroll in the Student Health Benefit Plan, you'll click on Enroll Me on the insurance plan communication that was sent to your MyU account. Next slide, please. In the United States, even with health insurance coverage, an individual may have additional out-of-pocket costs when seeking medical care. Copays are small fixed dollar amounts that are charged each time you go to the doctor or have a prescription, with the insurance plan then paying the remainder of the cost for the visit or prescription. With the Student Health Benefit Plan, when you have services outside of Boynton, you may need to pay a deductible and coinsurance. Deductibles are annual dollar amounts which must be paid for services before the insurance plan begins to pay for any covered services. Coinsurance is a percentage of the claim that you must pay, with the insurance then paying the remainder. However, all of the plans have a maximum annual out-of-pocket amount so that once you reach that amount, the insurance will pay 100% for all remaining eligible claims. The Office of Student Health Benefits has detailed information on its website showing coverage levels for different types of services for each of the health plans. Next slide, please. Our plans are designed so that most individuals have very low out-of-pocket costs when obtaining medical services. Boynton Health is usually your lowest cost and most convenient alternative for medical care. In fact, most services provided at Boynton result in no out-of-pocket cost for those on the Student Health Benefit Plan, and just a $10 copay for those on the Graduate Assistant Health Plan. The medical identification card you receive from the insurance company will have their website information that enables you to find other available in-network providers when needed, such as if you require immediate care when Boynton's closed, or if you require a service not provided by Boynton. Our insurance company is called Blue Cross Blue Shield of Minnesota, and the provider network is called Aware. You'll need your medical identification card when obtaining services or picking up prescriptions at places other than Boynton. If using a provider other than Boynton, it's important to confirm that they're in network before obtaining services, as you often must pay more out-of-pocket costs when utilizing providers who are not in network. It typically takes a couple of weeks to receive your medical identification card. If you need medical services prior to receiving your card, please contact the Office of Student Health Benefits for assistance with your coverage. We're here to assist you and help answer any questions that you may have about your medical coverage. The next presenter is going to be Katie Olson-Williams, who will provide some important information on housing and residential life.
Hello and welcome. Again, as Greg mentioned, my name is Katie Olson-Williams and I use she, her pronouns. I'm an assistant director here in Housing and Residential Life at the university and have been here for 9 years. Housing and Residential Life provides housing to over 7,400 students on campus throughout 17 buildings located on the East Bank, West Bank, and St. Paul campus. We provide opportunities for students to meet others, to work, and have staff on site as a resource and for crisis response. In addition, we have 38 unique living learning communities where students live in a community with others that share the same academic goals or personal interests. Move-in for new spring residents is in the apartments this Friday, January 6th, and for traditional resident hall move-in is Saturday, January 14th. Next slide, please. We do not currently have any specific protocols for COVID. However, our website does have a lot of resources available if you have questions about what to do if you feel sick, have been exposed to someone with COVID, and updates around policies such as masking. As Michelle mentioned, masks are not currently required unless you are isolating. However, community members are welcome to wear one if they wish. We encourage everyone to take responsibility for their own health needs and to do the right thing when not feeling well, such as testing and isolating if necessary. If you need a test, we do have them available at our information desks in each hall. As I mentioned, our staff are available as a resource to you in each hall community, but we all play an important role in our community. Should you experience or witness a bias incident, please report it as soon as possible to your CA or submit a report to the bias response and referral network so we can provide support and follow up. Now I will pass it back to Marina from ISSS to lead the question and answer portion of the health and wellness webinar.
Thank you, Katie, and thank you, Michelle and Greg, for your very detailed information. I'm hopeful that it was super useful for our students. So we will now begin the question and answer portion of the session, which will last about 20 minutes or so. You can submit your questions via the chat by clicking on the button below. Ray and UofM will be monitoring that for us today. Again, we may not be able to answer all of your questions, but we will have staff moderating it and we'll follow up with students after the session is done. While we wait for some of your questions being submitted, I am going to pass the microphone to UofM, our Senior Global Gopher leader in ISSS, to share how to stay connected in ISSS.
Thank you, Marina. So there are many ways to stay connected with SSS and the partnering offices on this webinar. If you are a new student, you can email us at sssnew@uofm.edu or find additional information on our website at sss.uofm.edu/new or our international travel page. The links will be shared to the chat later on. For all students, if you have specific questions about your situation, feel free to email your question to the appropriate office. We'll be sharing their contact information at the end of the webinar as well. For our next event, the exciting SSS Welcome Session and Global Gopher Welcome Dinner, it will be on next Tuesday, January the 10th at Great Hall, Kaufman Union, from 3 to 6:30 p.m. So there's for different students, probably you have different ways to register. For a new student, you can scan this QR code or go to My SSS to find the register link to register for this event. For current students, I will share with you a link to register for this event. Back to you, Marina.
Thank you, Yueting. And I will go ahead and start with the Q&A. I'll start with our campus partners in Housing and Rest Life and Katie for just maybe a question or two regarding housing. And I know you mentioned that there will be COVID-19 testing available. Can you mention again, where will that be available at, Katie?
Yeah, so when you arrive to your residence hall, you're going to check in at the information desk. There's one located in all of our buildings. And at the information desk, there will be student staff working who will be able to provide that test for you. You can just request the COVID test and they will be able to hand that to you right then and there.
Okay, thank you, Katie. And our last question is, are there any COVID-related or health policies while living on campus or anything that we should be aware of while living on housing and Rest Life?
Yeah, so right now we don't have any specific policies around COVID in terms of masking unless you are positive for COVID. All of the most updated information around COVID and health safety is on our website. So again, I would direct you there. There are kind of some FAQs or frequently asked questions and answers around where to get testing, both from the information desk or from Boynton, as well as what to do if you are testing, if you do test positive, if you need a different room to stay in, and some other things to keep yourself and your community safe and healthy.
Thanks, Katie. And then one final question. Are you hiring for community advisors, and can international students apply, and when would be a good date to start looking for those positions?
Yeah, so the community advisor application process is closed for this next fall. However, if you are interested in being a CA, it would be for fall 2024. Those applications will be coming out in October. So the application process for a CA is typically opens in October, and then you would be the CA for the following year. However, we do have a number of other positions for students available in our residence halls, including desk staff, which we call office assistants or OAs, as well as currently with some facility staff. So a lot of opportunities there. We also have student positions available in our central office and over the summer. So definitely look on our website. We do have a job site. I can get that link for you with all of our student positions, and the way to apply and more information will be on our website as well.
Thank you, Katie, for your answers and for presenting today. My next questions will be for Boynton and Michelle. Can you let us know what kind of evidence do we need to provide indicating that we've been vaccinating, and particularly what if it's not in English?
Yep. So the evidence that you need to provide is a vaccination form, and it does need to be translated into English, and you just scan that into that MyU site, and there was a slide that gave directions on that. And if you have questions about what you have were to count, you can definitely call that nurse line, and they can help walk you through that process.
Thank you. How about if I am going to get vaccinated in my home country before the arrival? In this case, do I still have to self-quarantine right after I arrive on campus?
Yep. Nope. There's no rules on that at this time, but you do need to make sure that you complete the vaccination with the 14 days before your arrival. And if you want to get tested, there's tests available, as Katie talked about, in Housing and Res Life, or there's also tests available at Boynton. And if you do, upon your arrival, if you are feeling sick, it's really important to stay at home until you're feeling better, to get tested against COVID-19 and to follow those protocols.
Thanks, Michelle. Many students are now arriving to Minnesota, getting ready for the first day of class in a few weeks. What happens if they do test positive right before school starts? What do they need to do for that first week of school?
Yep. Yeah, so the Safe U campus website has a lot of great resources on what to do. It's really important that if you test positive for COVID-19, that you stay home for your isolation period, which is going to be 5 days from when you started feeling sick or from when you first developed symptoms, and that you wear a high quality mask from days 6 through 10. If you're some people still feel really sick on days 6, 7, 8, and it's really important to stay home until you are feeling better. And it's important to communicate with your professors and let them know what's going on with you, and they will work out a plan with you. And it's happening to other students as well. And it's a tough thing, but we're all pretty understanding about it.
Thank you, Michelle. I think those are all the questions for Boynton right now. My next questions will be for Greg at the Office of Student Health Benefits. Greg, when does the Student Health Benefit Plan start? And if I land in the US, let's say tomorrow, what kind of insurance do I need for that time period?
Yep, so good question. So as I stated, the university requires you to have health insurance, so you will ultimately be on one of the plans, either the student health benefit plan or the graduate assistant health plan. In terms of the spring semester, the official start date of the student health benefit plan is January 17th of 2023. So you might be coming here earlier than that. And also for the graduate assistant health plan, the official start date of coverage on that is February 1st of 2023. So ultimately, if nothing is done, if there's no manual intervention done, then your coverage will be starting on those dates. Now, if you're going to need health services prior to that, contact our office and we can get your coverage started as of the day that you enter the country. But if you have just sort of routine things that can wait until January 17th, we'd ask that you just kind of go through the normal process as opposed to having the manual intervention to have your coverage start earlier.
Thanks, Greg. That's good to know that students can get insurance or get coverage should they need to when they arrive. The next question is regarding immunizations and immunization requirements. Can I get them done after I arrive to the US, and will my insurance cover it?
So the COVID.
Go ahead,
Greg.
Michelle. I'll say yes, your insurance will cover it.
That's great. And you need to get the COVID-19 vaccination before coming to the US. However, you could get your other vaccinations here, and your insurance will cover that. And Boynton would be a great place. You can give us a call. You can schedule an immunization through the portal. You can get several immunizations at one appointment. If you're not sure what you need, a nurse can help walk through that process with you, explain it, give you the vaccinations, and make sure you've got that proper information to submit your documentation.
Thank you, Michelle and Greg, for that final question for all of you. We do have one more presenter today, Grace Machoki, who is our Assistant Director in ISSS for advising. And I would like to invite her to just do a quick intro, but also ask her a few questions related to international students specifically. Particularly, are there any new travel updates for some international students regarding a negative COVID test, which just came out recently?
Thank you, Marina, and welcome to the new students who are on this call today. And thank you to my colleagues who've been presenting today, really great information. My name is Grace Machoki, Assistant Director for Advising at International Student and Scholar Services. Like many of us who are on this call, as staff at the university. I also went through the UofM graduate program as an international student from Kenya. I was speaking around to see if there's any Kenyan on the call, maybe recognize them by the name. And so I'm really, really happy always when I have the opportunity to be a part of a call like this, where we are welcoming our new students, trying to make things easy for them before they arrive by providing information. So thank you for taking the time to be here. So one, Marina did ask about the new update that we have, which came out recently about travel. And so this is the US Center for Disease Control, CDC, has implemented a requirement to demonstrate negative test results effective tomorrow, January 5, for travelers from China and special administrative regions of Hong Kong and Macau. So we would like for you all, if you're traveling from these locations, please to go through the CDC website so that you can get more information about what these requirements are, to have up-to-date information so that you have what you need to have to be able to travel safely and successfully. So when we did, when this information came out, we sent an email to all our students. And since, as you can imagine, there's always something evolving around COVID, we really want for you just to be able to go into that website, CDC, in addition to all the information you're learning from Michelle and about, the University of Minnesota system as well, so that you are prepared. And if you have any questions about that, especially about travel, you can definitely reach out to ISSS. You can send your emails to ISSS-new, or you can send them to ISSS@UofM.edu as well. Somebody will be there to talk to you. And if you find yourself at any of the airports, and maybe it's during the office hours, and maybe you need to verify some information, you can try and call the office number, which Marina, if you can have maybe that number there, that would be really helpful, so that students can have that number while they're traveling in case they're able to reach us. Thank you.
Thank you, Grace. My last question will actually be for Ray, who's one of our student leaders, or Yueting, I guess, whichever one feels like answering today. Is there any particular advice you would give to take care of your health in the United States?
I will go first. I think besides physical health, mental health is a very big part in studying here. Sometimes you will feel homesick, sometimes we will feel stressed. It's really good sometimes you just go to find a counselor to talk about it, and you will feel relief about it. And yeah, besides that, I will say you also can take some PE class, just get some exercise and have fun, enjoy it. It's 1 credit, super easy class, and like gives yourself a little break.
Thanks, Ray. How about you, I think?
Yeah, I totally agree with Ray. There are lots of resources on campus. I mean, especially from Boynton, because recently I found out that there are so many free tests for you. You can do annual check for your body, for like blood testing to make sure your physical health or your body is still strong and right for further like academic studies or something. In addition to physical health, also mental health is important. Boynton mental health and other counseling services, or talk to a friend or pause, there are great resources. I use them a lot during my semester. Definitely they support me a lot during like midterm or final season.
Thank you, Yueting. And I believe this is the last of the questions we have for today. Thank you again, everybody, for attending the International Health and Wellness webinar with Global Gopher Experiences. And we look forward to seeing you, hopefully all of you on campus soon, and on January 10, if you can join us. Hopefully we'll be able to address all of your questions and concerns you had. Again, it's a lot of information, so feel free to reach out to any of us. And if you want a starting point, the ISSSnew@umn.edu account is a really good first point of contact to just get your questions referred out to the right campus partners. So for questions specific around COVID testing or vaccine availability, you can reach out to Boynton Health directly at bhquest@umn.edu. Questions about your health insurance and coverage to the Office of Student Health Benefits at umshbo@umn.edu. Any questions about on-campus housing, you can contact the Office of Housing and Rest Live at housing@umn.edu. And then you can reach out to us at ISSSnew@umn.edu if you're a new student, or ISSS@umn.edu if you're a continuing or returning student. Again, you can just start with us if you don't know where to start. Thank you again to all of our campus partners today for making this session possible. Michelle from Boynton Health, Greg from the Office of Student Health Benefits, Katie from Housing and Rest Live, Grace, Ray, and Yue Ting from ISSS, and then all of you who were able to join us today to talk about health and well-being. Hopefully we'll see you on January 10th. And before you get going, we will play a video, but you can stay if you want to, but otherwise we'll see you next week.
Welcome to the
So thank
University
you.
of Minnesota. We are Boynton Health, and we're excited to help you get a strong start to your college career here. We understand that it can be overwhelming to take control of your healthcare needs. That's why we're committed to helping empower students like yourself. There are a variety of clinics you can choose from here at Boynton, from primary care, urgent care, Gopher Quick Clinic, dental and vision services, gynecology and gender care, nutrition services, physical therapy, immunization, and a pharmacy. And as a student, you can access most of these services at little to no cost.
So now that you know what Boynton Health has to offer, you might be wondering how to get treatment. There are many ways to access care. You can make an appointment by calling, stopping by in person, or visiting My Boynton online patient portal. Through this patient portal, you can access immunization records, receive test results, and update your patient profile. Not sure what kind of help you need? No worries. We have a 24-hour nurse line available to help you access the right care.
Of course, after you make your appointment, you might be worried about how much it will cost. As a college student, finances can be a huge concern. Most students can receive care at little to no cost. You must meet two criteria. You need to pay the student services fee for the semester that you're enrolled in, and you need to be on an insurance plan, either a private plan or the university's plan. Most students must have insurance to be able to attend the university.
The plan offered through the university is called the Student Health Benefit Plan. It is charged to your student account alongside the student services fee and tuition. The Student Health Benefit Plan fee varies yearly, so be sure to check out our website for the most up-to-date cost. You might choose to opt out of the Student Health Benefit Plan and might be worried about paying for Boynton's health services. Don't worry. Regardless of what kind of insurance you have, most students can be seen at our clinic at little to no cost.
Boynton Health also does a lot of public health outreach across campus. We work to promote the physical, social, and emotional well-being of all students across campus inside and outside the walls of the clinic. Be sure to take advantage of programs like Nutritious You, Food Pantry, and Gopher Chauffeur. If you're feeling overwhelmed, you can put away worry and stress with Pause.
If you're a student living in a residence hall on campus or a fraternity and sorority, talk with your student health advocate. These students are first aid and CPR certified and can help with other common health related issues by referring you to other campus health resources and sharing information. These students provide cough drops, bandages, safe for sex supplies, cold and cough and pain medicine. Other health promotion resources also include stress check-ins, safe for sex supplies, and Recovery on Campus, which is a student group that provides support and resources for university students in recovery through social activities and regular meetings. Boynton Health offers individual therapy, couples and group therapy, and student counseling services. We also offer stress check-ins. Stress check-ins provide an opportunity for you to talk through stress in your life, come up with solutions, and connect with campus resources.
You can find us on the East Bank Minneapolis campus and the St. Paul campus. We're open Monday through Friday during general business hours. Don't hesitate to give us a call or visit us at the clinic. You can find more information at boynton.umn.edu.
Be sure to visit MyU to fill out the immunization form and the insurance declaration form.
Thank you, everybody, and we will see you all later. Have a happy New Year's to 2023. We'll see you when you get here. For our campus partners, you can all leave, but we'll stay just a few more minutes behind for new students if you have additional questions. So Ray, Yueting, and I can stay behind. So thank you, everybody, and we'll see you all soon. Drive safe. Just making sure that there are no questions from our new students. Nope.